process in accounts, receivables in medical billing. In medical billing, accounts receivable refers to the outstanding payments owed to a healthcare provider for services rendered to patients. Managing accounts receivable is crucial for the financial health of medical practices. There are several types of accounts receivable in medical billing, each representing different stages of payment processing. Here are some common types. Current accounts receivable. These are the outstanding balances for services provided recently and are within the payment terms agreed upon with insurance companies or patients. Typically, these are due for payment within 30 to 60 days from the date of service. Aging accounts receivable. This refers to the breakdown of current accounts receivable based on the length of time the balances have been outstanding. Aging is often categorized into different buckets, such as 30 to 60 days, 61 90 days, 91 120 days, and over 120 days. The older the account, the more challenging it may be to collect payment. Insurance accounts receivable. These are outstanding balances owed to the healthcare provider by insurance companies. It includes claims that have been submitted but are still awaiting processing or have been denied and need to be appealed. Patient accounts receivable. This category includes outstanding balances owed by patients after insurance claims have been processed. Patients are responsible for co-pays, deductibles, and any remaining portion of the bill that insurance doesn't cover. Self-pay or uninsured accounts. Receivable. These are balances due from patients who do not have insurance coverage or who have chosen to pay for services out of pocket. Bad debt accounts receivable. This type of accounts receivable represents unpaid balances that are considered uncollectible. It occurs when a patient or insurance company is unable or unwilling to pay, and collection efforts have been exhausted. Contractual adjustments. When healthcare providers have agreements with insurance companies or government programs, certain amounts of the billed charges may be contractually adjusted, meaning the provider agrees to accept lower payment than the standard fee schedule. Denials and appeals. These are accounts receivable that involve claims that have been denied by insurance companies, and the healthcare provider is in the process of appealing the decision to seek proper reimbursement. Self-insurance accounts. Receivable in some cases, large organizations or companies may self-insure their employees' health coverage. Accounts receivable from self-insured entities represent the amounts owed by those organizations for medical services provided to their employees. Proper management of these various types of accounts receivable is essential for medical practices to maintain cash flow and financial stability. Billing staff and revenue cycle management teams work diligently to process claims, follow up on outstanding balances, and pursue collections to ensure that the healthcare provider is compensated for the services they render. Having an external support from established AR calling team can make a lot of difference in terms of quality and collections. eCare India is a pioneering offshore medical billing company that has been providing services for over 2 decades. Our services include revenue cycle management, accounts receivable management, indexing medical records, prior authorization, insurance eligibility verification, denial management, charge entry services, credentialing services, emergency room physician billing, dental billing, radiology billing, cardiology billing, anesthesia billing, ophthalmology billing, pulmonology billing, ambulatory surgical center billing, medical coding services, nurse practitioner credentialing, medical document management, FQHC billing services, etc. Our team of professional medical billing experts decreases denials and increases revenue. We can save you costs up to 40%. Contact us email ID sales@ecareindia.com. Phone number +1 813 66 028. Website www.ecareindia.com.